a photography session. Bismillahirrahmanirrahim. We'll open our ceremony with the recitation of Al-Furqan Al-Fatiha. To our distinguished guests, Brother Saifurreza Muhammad, Acting Director of Counseling and Career Services Center, CCSC IIUM, Sister Khaira Abdul Razak, Senior Clinical Psychologist, Counseling and Career Services Center, CCSC IIUM, Brother Iman Hassan Basri Abdul Halim, Program Manager of Grand Mental Health Month Program GMHMP 2022, the list of panelists of the online roundtable discussion, Mental Health for All from Youth Perspective, the invited guests from Kuliah Based Society Council KBSC IIUM, working committees of Grand Mental Health Month Program GMHMP 2022, brothers and sisters. Assalamu alaikum warahmatullahi wabarakatuh and a very good evening. I'm Iman Jamil, President of IIUM Peers, as your moderator for tonight's event. On behalf of IIUM Peers and GMHMP Committee, I'd like to wish all of you our utmost appreciation and gratitude to have the presence of all of you here celebrating the importance and bringing forward the awareness of the status quo of mental health right now, especially in today's youth. Before we proceed, let us sing together the IIUM song, Leading the Way. For the ones in Zoom, we are currently broadcasting the IIUM song at the YouTube, so there will be a 2-minute gap before we continue.
Let's lead the way, lighten the future, share the wisdom to the spirit of Islam. Revelation and reason shall excel, shall prevail. Merging faith and knowledge, we, the Khalifa, we will fulfill the Amana. Together, we make the world a better place. Forever, expand the culture of Iqra. IIUM is to realize the meaning of Rahmatan lil Alamin. Together, we make the world a better place. Forever, expand the culture of Iqra. IIUM is to realize the meaning of mercy to all worlds for mankind.
Brothers and sisters, this online international roundtable discussion, Mental Health for All from Youth Perspective, is organized in conjunction with the IIUM Grand Mental Health Month Program 2022, where we invited 10 panelists from 9 countries, aiming to analyze the situation of students' mental health in different universities around the world and discuss challenges occurring the possible factors that lead to them, and impactful, or most importantly, effective ways to combat from the youth perspective. Audiences watching from YouTube may type in your questions at the live chat box by stating your name, the panelist you're addressing the question to, and your questions. The questions will be answered during the Q&A session. Also in the chat box is where the link of the evaluation feedback form for star points and e-certificates purposes will be released in the middle of the program. Let us now continue by inviting Senior Clinical Psychologist from CCSC, Sister Khaira Abdul Razak, to deliver her opening speech.
Okay, Assalamualaikum warahmatullahi wabarakatuh and good evening. Okay, thank you to Sister Iman for moderate very well in this session, Alhamdulillah. So first of all, Alhamdulillah, this is what we call, this is what we want for peers to have, the international online roundtable discussion, which advocates and talking about mental health among youth. And we have like panelists from different countries like Indonesia, Singapore, Tanzania, Egypt, so Brunei also. So all of you are actually welcome to deliver your ideas and share about what happened in your country in terms of mental health, the awareness and the acceptance of people in your country about mental health itself. Because in Malaysia, what we can say that the young people, they are aware about mental health. They talk about mental health and they are brave enough to share about their stories, about their mental illness. However, what I can say that here we still need to actually focus and highlight more on the resiliency of the young people, especially when they have problem, when they have issue, how actually they cope and bounce back, and how they can what we call understand themselves and have a proper self-compassion towards themselves and a self-concept about themselves. Okay, so we want to listen more from the panelists that come from different country. Maybe you have different experience, different point of view, and at the end we will bring one what we call consensus ideas that come from all of you, and we will bring that and highlight that, and we inshallah we will publish that soon after we finish this event. Okay, so I think that's all from me. Good luck, all the best to all of you, and I hope that this event will be beneficial to all the young generation, young people, and the youth over the world, inshallah. Thank you.
Thank you, Sister Kaya, for the inspirational and eye-opening speech. And I very like that she mentioned something about resiliency and bouncing back and the coping. I think that's very related to our topic for today, which is mental health for youth. So without further delay, directly to the core of our event, we will commence our roundtable discussion with the theme of mental health for all from youth perspective. First of all, I'm very humbled to have the honor of moderating this discussion, especially when I've looked back into the panelists' background and what they do and their contributions that they have done and given out to the society. So first of all, allow me to introduce the line of panelists. First, from Indonesia, we have three. Alhamdulillah, Sister Chan Yaksmin Loy, Sister May, Sister Novi Octaviani, Sister Novi, and Sister Madeline Teresa Lee, Sister Medi. And then we have from Brunei, Sister Aiman Hanani, from Thailand, Sister Natida Chutika, from Mali, Brother Sofiana Salim, from Tanzania, Sister Taiba Sharif, from Bangladesh, Brother Hassan Al-Banna, from Singapore, Sister Aisha Amina, and from Egypt, Sister Asma. I like to really stress on this point if possible. The way this roundtable discussion is going to be conducted is that no question is exclusively for one person, meaning that if I throw a question to a panelist, other panelists are welcome to also give their opinions on this matter. And with that same line of thoughts, I encourage panelists to ask questions among each other, and please feel free to interject me if you like to add on and further comment about any matters that are brought up in the discussion. Okay, so perhaps we'll start with the one in my screen right now is Sister Novi. So perhaps we'll start with Sister Novi first. Um, Here in Malaysia, youth mental health has gained attention only in recent years, especially after COVID, due to the loneliness factors and all. But usually the mental health struggles of youth, they tend to be taken lightly, especially when like people consider that we youth do not have anything significant enough to be bothered about, to be stressed about. But however, according to the 2000 National Health and Morbidity Survey, some 424,000 children in Malaysia are struggling with mental health problems. So that's an indication that mental health issues among the group have become an epidemic. So, what about the current situation in Indonesia?
Okay. Ya, Assalamualaikum warahmatullahi wabarakatuh. Thank you, Sister Iman, and hello everyone. I'm Novi. I'm a clinical psychologist from Indonesia, and currently in Indonesia, actually, the situations is all about the same with the Malaysia and another country maybe. Yeah. The youth in Indonesia is also have a potential have mental health problems. According to the Health Ministry of Indonesia, the prevalence of people with mental disorder is about 1 in 5 of the populations, meaning that 20% of the populations in Indonesia have the potential to have a mental health problem, and included the youth itself.
Um, so I noticed that the situation is pretty much similar. How about what do Sister May? I'm aware that you're Cambodian but you somehow live in Indonesia right now, I believe. So what about you? Do you think that similarly with Sister Novi?
Yeah, I actually also agree that recently mental health topic is actually gaining more awareness right after COVID-19, because I feel like during COVID-19, a lot of youth, especially students like us, are struggling with mental health, like mental breakdown, depression, and stuff because of like lockdown and our online classes. Like it's hard for us to stay focused and to stay productive. So yeah, I also agree that mental health issue is actually uh, gaining more awareness, as well as there are a lot of people who are struggling with it.
Um,
Thank you.
let's switch up and see what's happening in the African side, perhaps. Sister Asma, what is your perspective on this and what's happening in your, it doesn't have to be at the country, maybe like a smaller scope at the university, maybe? Right. What about Brother Hassan?
Assalamualaikum.
Alaikum salam wa rahmatullah.
Thank you, sister. Actually, mental health in Bangladesh actually it's been a taboo. I think in the policy level it's been overlooked. But I think since after COVID-19 global crisis, the page has been turned, and now the government as well as the university administration, society is focusing on that. Uh, you will be surprised that Bangladesh government for the first time started their national policy, national mental health policy 2020 this June. So it's just started. So I think it's highly appreciative, but it's so late. And also I think the topics of mental health has been neglected. among societies. Even like when youth try to do something in their daily life or they want to contribute to society, uh, but the mental health issue has been stopping them. I I think by time to time it will improve.
Sister Taiba, um, what are we have heard from the other countries that uh, though it has been neglected in the past years, after COVID came around, then all the governments started looking into it, putting efforts to let it be more in the focus, in the highlight, so that we can overcome this problem. So what are the efforts that your local authority or government or organization in your country have made to promote this positive well-being in regards to mental health?
Thank you for the question. So first of all, it's really nice to see that a lot of countries are bringing up the talk on mental health. Great to hear that even Malaysia is coming up on the list. But unfortunately, in Tanzania, this hasn't been the case. So mental health hasn't ever been a topic of priority or discussion, be it in the local level, be it in the university level. So what I'm hearing is for a lot of people, things have been changing after COVID, but unfortunately here, COVID or not, things have still been stagnant. It's very difficult for people to even initiate the talk about mental health. It's just not seen as something of priority. It's not seen as something that's worth investing in, worth talking about. So very similar to what Hassan said as well. It's a taboo, it's a stigma. So despite COVID-19 being such a huge slap on our faces that, hey, we need to start talking about this, things here still have been very, very slow. And unfortunately, there just hasn't been much initiatives on this part of the country.
Uh, is it possible for me to want to know more about Tanzania? Like, you mentioned that there was not much effort even after COVID. May I know further about how that decision, how that decision from the society affects your youth? How do they feel about it? Uh,
So I think because from the start itself, there hasn't been much talk about mental health. So even though the youths might be suffering or struggling, they probably don't know that they're struggling. So people could be going through symptoms of, say, depression, anxiety, stress, but because the talk is not there, it's been normalized so much that they don't feel like they have a problem. So even when you come forward to them and ask them, how have you been impacted by COVID-19? They will tell you everything else except their mental health, because for them it's been something that's very normal. It's as though everyone goes through it, so why talk about it, why make it an issue? So yeah, that's how the youth have been impacted, unfortunately.
that's very sad to hear. I'm so sorry for that situation. But inshallah, for after this discussion, after we compile all the solution, then there will be some ways that we can help with that situation. Um, let's look at the situation at Singapore, Sister Aisha.
Yes, thank you, Sister Iman. I'm honored to be a speaker on behalf of Singapore, but honestly, I've been studying in Malaysia, but nonetheless, our mental progression is improved by immersing ourselves in a pool of opportunity, but we cannot deny the sensation of our unfamiliar state of significant inflection point for many young adults, full of senses of anticipation, opportunity, connection, and responsibility. At the same time, uni students often face a variety of novel challenges that may be associated with stress, suffering from higher level, mainly anxiety, depression, including increasing academic workload or pressure to succeed. So it is necessary to understand the relationship of mental health with society. CCMH annual report nationwide, the average cost caseload for full-time counselor in around 120 students per year, but some center have more than 300. A survey put forth to improve on the quality and quantity of uni mental health service by the inter-university network made up of youth representative of Singapore from 5 student union. About 470 students across 5 universities were polled and reported what seemed to be high level of stress on average, with work and study commitment on top of their list of sources of stress, of course. The network believe this shows the importance students face the great obsession, because in Singapore it's usually people are obsessed with A grade pass. It is a challenge for us due to their own expectation or other factors that emphasize in the importance of studies. The report has shown the juggling long hours of these classes, submission, and work commitment being above 35%, 9 to 10 top cases of stress. So, the key finding of the survey that the Union of Students in Singapore gave us the first-hand glimpse into the means of the undergraduate student of the 5 university on how they view mental health and what they are doing to tackle it. So, looking at the end of the graph, 12% rated it a full 10 out of 10, which outlined the overwhelming number of students that are highly stressed. So 9 out of 10 students actually said that factor actually affected them the most, much higher than self-confidence as well as career likelihood, which are around 60%. And hence, this report data could be used to dig in better, effective approach in improving the well-being of student mind, which we could discuss furthermore later on, inshallah. I'll pass it back to the MC, to say Iman.
All right, thank you. I heard from Singapore just now that the assignment and the workload and the juggling of everything to do that was the main reason, the main factor of the stress, even higher than self-confidence level and career. Is that correct? I wonder if the situation is the same from the other country. Perhaps you can ask from Sister Aiman from Brunei.
Hi everyone. So I'm from Brunei, but I'm currently studying in the UK. So just
Uh,
from
you are free to give from both perspectives. In fact, you are invited to.
I think I'm in a very good position and a very lucky position to be in both countries and having those two comparisons. And I believe that Brunei is slowly getting there. And I think that's from a lot of the effort coming from our Minister of Health. He has recently made sorry he has recently made a pact kind of to work with Australia in regards to mental health, but I cannot deny that I am in agreement with everyone else that mental health has only recently been discussed. It was a big taboo speaking about mental health growing up, but I am very grateful that they have decided to take this matter in more seriously, because we are a very small country, and at the moment, just recent reports have said that about 7,000 people is suffering in terms of mentally in Brunei, and we are a population of 400,000 plus people, so that is a very big number. And I'm lucky to say that uh, the Bruneian government is quite keen on taking care of their Bruneian students in the UK, as we have created the role in the Bruneian Student Union, the Wellbeing Secretary. It's a very new initiative, and the role has only been around for 2 years. But we try to reach out as much as we can to every single Bruneian student in the UK. It's also been known that recently in the Bruneian side, they have had this initiative where they are starting to offer some free mental health first aider so that it is more accessible to the public. And yeah, it's slowly getting there, but baby steps. And I'm sorry to hear that some of the countries are struggling to kind of understand and adhere to the motion. But best of luck, everyone. Thank you.
Don't go yet. Don't go yet. I'd like to ask something else, if you don't mind. You mentioned something about a well-being secretary. Yeah.
Yes.
May I know like further details what it entails, what you do under that position, and also the first aid, mental health first aid? Do you like train your? Do you have a body where you train them, or you just pick up any volunteers, or how does that proceed?
Okay. So thank you for the question. So I'll answer the first ones. So the the Brunei Student Union in the UK is a body of students, university students, who volunteer into the position. So during that, as the well-being secretary, I am in charge of providing some listening services to some of the students that are struggling. So we do have we do Google form, and then you talk about what you need help with, and we will arrange an hour one-to-one just between the two of us, and they can speak about their problems. Obviously, we are not um, of any sort like a mental health professional. So if there is any safeguarding issues, we are to bring it up to this to the authority. The mental health first aider is an initiative in Brunei where the mental health professional body, so the psychologists and all the mental health professionals back home in Brunei, they're starting to provide these services where people who are at work, or it depends on perhaps the company that you work in, and what they are allowed and they are invited to kind of get in contact with the people, and they will hold a session where the professionals will advice and discuss of what you can do, and when you're qualified you are able to kind of deal with the situation better. But yeah, that's all from me. Thank you.
Thank you very much. Sister Mehdi from Indonesia, I wonder if there are these forms of assistance in Indonesia too. Yeah, and the current situation of Indonesia in your environment.
I guess from my perspective, there are still there is several storage of mental health, um, personal treatment and care facilities, especially outside of the island of Java, is still short and is still lacking. But in this era of where advanced innovation is implemented into our world, I think Indonesia itself have already built up an application for a teenager or someone who needed this application. There are some that I know, and I already observed it myself, and it really helped people, those who needed that assistance to um, improve our mental health in Indonesia.
And thank you very much. And we haven't heard from Thailand, Sister Natida.
Uh, uh, Mental health in Thailand. The most children in Thailand are affected by mental health problems, both stress, anxiety, pressure by school. Some mental some mental health from school in Thailand will give a lot of homework until students have no free time enough. Thank you.
Thank you. I wonder if the situation is the same in Mali too, Brother Sufiana?
Okay, I think you can hear me now.
Yeah, I
Can
can
you?
hear you.
Okay. All right. Thank you so much, the moderator, Sister Iman, and good night, Malaysia. I think you are at night now. Now
Yeah,
I'm speaking to you from Mali. Now we are 1 p.m.
in the morning.
Yeah, in the morning.
MashaAllah, thank you so much. Thank you
Yeah,
so much.
thank you so much. First of all, I think in Mali here, or I can say in general, in West Africa, in general, in the first place, we have problem with the concept of mental health here, because in our society or in most of the West African country, we have the problem with the concept of mental health or seeking help from professional psychologist or this kind of thing, because in here disclosing or telling your problem, personal problem, or your personal problem or feelings is like a sign of sickness or a sign of idiocy or stupidity. Sorry for the word. Because here people like to keep his personal feelings or personal problems. If you have problem, people in our society here, people tend to keep for himself, not to tell or disclosing your personal problem to another person. This is in the first place. Even in family, if you have a child or something, you have problem. If you try to say, they will not take you seriously. They will just, oh, keep, you will pass it, it will pass, it will pass. And until you grow up, this is the first place. Even someone, in the second place, even someone has a courage want to disclose he is maybe is depressed or have some feeling problems or something like that. In the second place, if he or she decide to tell this problem, in the first place, he will tell tell the problem to his close friends, family members, or some of his relatives. This in the first place, or he will go he will go to tell the problem to one of two religious leaders and some like this, but not to the stranger, or go seeking help from professional mental psychologists or professional counselors. These are the concept in here. In general, we have the problem with the concept of seeking help from professional mental health or psychologist or counseling centers or services. I think this is what I can say in the first place. Maybe if you
Mhm.
have.
Yeah, you mentioned that it is not looked so much, uh, but I was wondering if it is the case for all levels of society or only the elderly. Let's say in Malaysia, the elderly might think that way, but most even students in primary schools, they already know the importance and have mental health awareness. So let's not say about the teenagers and all. So nowadays, mostly uh, only elderlies look down upon the importance of mental health. So what about at Mali? Is it like all levels of society or only a certain a certain category. And also, you mentioned about when people have problems, they go to religious leaders aside from friends and family. So I was wondering, what is the take of the religious leaders of your country? Or of course, you don't know each one individually. So maybe like on average or roughly, or like the overview, what is the take of religious leaders in your country when someone tell them about their mental health? uh, is it
Okay.
like go ask to read Quran, it's all Allah, mashallah, your iman is weak? So how is their response?
Yeah, for your first question, as I say, for the child in this age or maybe primary school students, in this age, if you are feeling in general, if child, child he likes or want to tell everything he's feeling or something happened, will go so in generally to tell to his mother. But in here, even he say, oh, I'm feeling these or these kind of things, no one will take him serious. The only thing we will tell him is, oh, this is normally it will pass, it will pass. And if the child grow up with this mentality, even he gets or feeling something, after that he will just keep it the problem. He will keep the problem for himself and not tell to anyone. And for your second question, in here, for example, if these maybe I can say the minority of people who decide, oh, I'm feeling this, I cannot keep this depression or this problem with me. I want to see or to tell to someone else. As we say, for religious leaders, even these people also religious leaders or imams. In the first place, they will, oh, maybe your iman is weak or you are doing sinful acts. They will just okay, you need to do this salat and always keep yourself with wudu supplication and do this dua and do this dua. I think in general these are the kind of responses for the people who tell for from the religious leaders and imams in general.
All right, thank you so much, Brother Sufiana, and especially for waking up early in the morning. We have heard from West Africa. Let's hear from Egypt, the transcontinental country, also Africa, also Asia. Let's hear from Sister Asma. Sister Asma, is the situation the same as more
Hello,
similar?
Salam Alaikum.
Yeah. Waalaikum salam warahmatullahi wabarakatuh. Yeah, go ahead.
Thank you. I was really stressing about you. You already said everything about the mental. We have like similarity between all of the conditions. So actually, like I want just to stress on something that we here in Egypt have like 31 percentage of like mental health issues for Egyptians, and 25 of them that they have mental issues and they are compensating it with addictions and drug abusing, and there is no any like any awareness of this, and this is affect mainly the rural areas. The and we have like awareness doesn't include these areas. um, we have like like we have like a long history in civilizations about ancient Egyptians. They were have documented the mental health in papyrus.
Uh, did she get kicked out? Right. So unfortunately, Sister Asma has oh, she's back. Oh, all right.
I'm sorry, it was the
Yeah,
connection.
it's perfectly fine.
Thank you. Yes, as I said, they were like emphasizing on their mental health, and they were documented it, and as I told you, like in papyrus, and they wrote about it that it's like the mental illness that manifested to a physical manifest, and they were talking about. I would like to talk about like in another time, but you see, like from a long ago, they were talking about it, so it doesn't something like it's not modern, it's not new, it's really from like back ages, and many people ignores this. So we need really to increase the awareness about the importance of this issue.
Sister Asma, actually, almost all of the previous panelists, when they mention about the most prevalent factor or cause, they would always mention workload, job, juggling, and all those assignments. But when it comes to Egypt, you mentioned addiction and drug abusing. What do you think might be the reason behind that?
The reason behind that, like they want just to overcome what they have inside their mind, so they try to get it out in something physical. So they have the wrong directions. And most of us, if we have some depressions or something, just we go to the religious part, but they don't have like this awareness. We can just try to manage it through other things, but they just the first thing they go like smoking cigarettes, and then they when you ask him like about why you smoke, because he said like any answer, because it's decrease the stress, but this is not true. He just this is like a bad habit. He said, everyone, why you smoke, it decreased the stress. When I feel bad, when I have like depressed, I just go to smoke. And I found people like have another like drinking like weeds or something, also they say the same answer, just they to decrease the stress that's coming. So really mental health, it will lead to another issues, and it's really complicating. So we need to get to the source, because we have like a lot of complications related to this issue.
So you think it's a lot of factors? So she thinks it's a lot. Oh yeah, you're here. So you think it's a lot of factors coming together and creating like not exactly in a good way, but some sort of synergy, like a feedback loop that keep the cycle going, right? That's what I understand. And we have finished round one, where we have discussed the current situation of mental health in our respective country. And I feel that the situation is very severe. Even there are ones that, despite the rises of cases with the presence of COVID, they still do not look highly upon it. And even the ones that do pick up the problem and do something about it, the solution, since they take time, is uh, have still need some time before it can be really fruitful, right? And we have seen that from the Brunei, we have 700,000 people who have mental health. And here in Indonesia, one of five population tend to get affected by the issue. And we have numerous other statistics, but but the most important thing, that the key is that we can see that this is a very, oh, it was 7,000 people. Okay, that's even worse. Even worse, right? Let me go check. Yeah, even worse, from 700 to 7,000. Yeah, so it's a really serious, it's a huge crisis. Now, faced with these problems and issues, I invite the panelists to switch our gears for a more solution-oriented discussion and put forth and bounce back ideas and suggestions that might help the youth of today combat this crisis. And if possible, I really like interactions between the panelists. Like maybe you guys could ask one another. Maybe if you're curious from the situation in another country, please feel welcome to do so. Yeah. Okay. So maybe this time we can start with Sister Taiba. What do you think? Do you have any suggestions, be it in the problem in your country or any other problems that was brought up by the panelists just now? Suggestion that could improve the situation of mental health.
Yeah, so personally, I think that first and foremost, what needs to be done is that awareness has to be there. And what I see, especially in my country, in Tanzania, is that um, even in the schools, let alone universities, there isn't any subject that teaches you about mental health. So only very recently they started to introduce psychology as a subject, but that even in A levels. So one solution would be that started earlier, when students are switching between their O levels to A levels, that is the right time to grasp this sort of information. Have mental health subjects start off from schools, ensure that there are counselors in each and every school. I see it happening in a lot of universities. There are counselors present, but unfortunately, they're not qualified enough. So even during my stay in Malaysia, what I realized was that the counselors in school, they were not really valued because when people would go to them, they would be scolded for what they're doing. So let's say if a youth goes and says, I'm having issues with family, or I'm struggling at home, the counselor, instead of trying to help them, would tell them, you're being a bad child, you're being a bad son or a daughter. And that really shuns people away from seeking support. So I think what needs to be done is introducing mental health as a subject right from high school, and ensuring that at least there is a counselor, qualified counselor in every school, in every university. Um, so when we focus on that, just making sure that the youths get the support, what about the people who are not getting the support? And these are people who are back home, such as your parents, your family members, people who are not achieving the same support as you when you go to schools and universities. So I would say that in rural areas, in local communities, there are people out there who have no clue what is stress, what is depression, what is anxiety, right? So it is important to at least collaborate even with NGOs to make sure that this information is reaching them, to at least let them know that if you're experiencing these symptoms, there is a problem. And when there is a problem, there is a solution as well. So the first step is to actually recognize that this is a problem. And the second step is to ensure that that help is available to them. Because it doesn't make sense if you just let them know that, okay, when you go through this, this is a problem. What are they going to do with that? They're going to need support. And if you don't give them the right support, they're going to end up, as what Asma said, they'll end up drinking, they'll end up with drugs. So it doesn't really serve the purpose. If we're going to target them knowing the symptoms, we have to ensure that they also know where to seek out help. But unfortunately, in countries like ours, in country like the country that I'm in, there aren't enough mental health professionals. So it's one thing to not have them, but I think if the government invests in it, if the government puts in enough money to support this initiative, then something or the other is possible, even if it means getting counselors from outside. But the priority needs to be there. And the other thing I would say is, normalizing the talk about mental health. So even in your own support groups, making sure that when you bring up something that's as sensitive as mental health, people are not shy to talk about it. So creating sort of a support group or a safe space amongst yourselves in your own communities to ensure that if someone else is suffering, they don't feel like they're alone. They feel like there is a place that they can belong. So yeah, these are some of the solutions that I had in mind, but I would love to hear what anyone else would have to suggest.
Thank you, Sister Taiba. Maybe we can hear from Brother Hassan. Yeah, what are your suggestions?
Hi, thanks, sister, for the questions. I agree with the sister Taiba because I think one of the common issue that has been facing in Bangladesh is the shortage of mental health professionals. I think the government should take initiative to have more professionals in the rural level, and also for the educational institution. The every institution should have a counseling session. Any professional who can help the students, especially for the youths. And also some of the recommendation might be to awareness among the population, because I think the mental health awareness is still not that popular in my country. I think only the university level, but still for the old eldest people and also the rural areas, and I think it needs to be more awareness. I think it can be done through street drama, rally, flash mob, or spreading flashcards in rural areas. And also, uh, treatment and medication should be available. I think this is the most important thing. Like, if someone has a mental issue or mental health problem, I think they should have the available option near them so that they can get help. I think for that reasons, there can be online helpline numbers that can, like, people can always call if they face any issue. Like, someone can listen to them. I think that's the important part.
All right, thank you. And from Thailand, Sister Natida, what about you?
Oh, I think school should not put too much pressure on students. School should be a safe area for students. Let students show their ability and capability. I believe learning from what students love, it will help uh, develop knowledge as well. Uh, Education can develop focus safely and be happy. Thank you.
All right, thank you. And I'd like to hear from Sister Novi, your suggestions, and also I'd like to add on a question. Uh, I heard just now from the first two panelists for the second round that we have to encourage governments. The governments can do a huge part to move forward in the for this issue. So, what are your suggestions so that we can encourage? So, what can we do as a normal people to encourage the government to put more focus in this matter?
Okay, yeah. Thank you, Sister Iman, for the questions. Actually, before we talk about the government itself, in Indonesia, actually, I have a platform called Heal Yourself Indonesia, and it focuses on mental health issues. Gitu. I realized that this mental health issues in Indonesia is an issue that should be addressed by many people, not only by the government, but from all the aspect of the people itself, because just like it takes a village to raise a children, so it takes a village too to educate people about the right perspective about mental health. So in my perspective, before we go to bring our opinion to the policy ministry or the government, we have to have opinion or a little step that we are addressed to do mental health promotions. Just like in my Heal Yourself that I did, that I do with my team, we are establishing an educational platform that consists of uh, content in Instagram about mental health. We are also doing an event, and also we are doing a counseling so that young people especially can have opportunity to know and learn more about the mental health. Especially in my work, I work on Islamic perspective, so that we are presenting content regularly, we are writing a books related to mental health, we are organizing classes, and also we provide mental health services. And in our future plan, just like Sister Aiman ideas, we are very excited about the mental health first aider, so that it can be something that we do to have huge steps to bring mental health for all perspective, so that people in Indonesia and also in another country will have a better perspective on mental health.
Right, thank you. Thank you, Sister Novi. And going back to Brother Sufiana from Mali, what are your suggestions to better improve the situation of mental health among youth? And also, I'd like to ask, aside from your suggestions that you may already have, you are free to speak them out. I'd like to ask, um, in your opinion, how do we bring help from where all the specialties are, from where the experts are, which is usually in the town, in the capital areas, to the rural areas? So how do we encourage? Do we like encourage migration, or do we train rural area? Or if we do, then how do you think we might go about that? So what do you think? Brother, you're on mute.
All right, sorry. What I can suggest here about the mental health is the first thing is to try to change the mindset of the population, to try to change the mindset of the population by telling them by telling them is okay if you have problem, or if you have something feeling inside you, if you are depressive, to tell, to seek for help, and to seek for help from any professional psychologist, because here seeking help from a stranger, or telling your problems, to disclosing your problem to a stranger, is as I say, is kind of a weakness, or is not in our culture here. So the first effective way is to change the mindset of people by telling them it's okay if you have problem, this kind of problem, just go and seek a professional psychologist, and who can help you. This I think it is the first effective way. And also we have here, because people, as a business, people is offer and demand. People don't people, they don't demand for mental health. So in here we have the lack of we have lack of counseling services or counseling centers. And also I think I can suggest this also for the government, to open more counseling centers, which where people can go and tell the problems. And what I can suggest also is yeah, same, is always to make a more awareness, to inform people about the issue of the danger, or the issue of mental health problems, and depression, anxiety, and so on. Sorry for your second question.
Yeah, would you like me to repeat it, or
Yeah, sorry.
repeat the question, right? So the question is, since there are a lot of problems that are happening in rural areas, because I'm here, right? Yes,
Yeah.
okay. There are many problems happening in rural areas. In the cities, there might be experts who can help. So how do you think we might go about this problem, so that even people in rural areas can get help? Mm.
Yeah, here, yeah, rural, for the rural areas, is if it's like the small village. If people have any problems, whatever the problem is, the first thing they will go to the head of the village or the imam. These are the two people that, if any people have problem, if they decide to settle the problem, they will see the imam of the village or the chief of the village. Sometimes they even people forget about the government and judge and so on. They will see imam or the chief of the village. Yes. And also,
Alright.
yeah, we have a lot of personal resources.
Yeah, all right. Thank you very much. And I'd like to ask next from Sister Aiman, representing Brunei. I'd like to know the suggestions or ideas that you have, and also, uh, what are your thoughts on how to diminish the barrier of when people they have a problem and they know and they acknowledge it and they want to seek professional help, but they believe that there are some barriers because I feel like to go from zero, from that, okay, you know you have a problem, and to 100, not 100 that you are cured, 100 that you finally meet a professional expert, you finally meet a therapist, you finally meet a psychologist. So from to that step, there seems to be a huge barrier that sometimes people in depression or people who have these problems, they cannot see clearly, they cannot think. So how do you think we can break down that barrier or lower down? Yeah.
Oh, thank you for your question. So I would like to just start with the first question. I think it's very important that we are youth and we're not old, but you know we're getting there. So for the younger generation, obviously this is not a fixable we give solution and it will we have to fight for it for a long time for it to get into the system and for it to start moving. So for the younger generations, I feel like children are very they're very vulnerable, and I think for us to make a big change is for us to start educating children from a very young age to kind of be aware of mental health and the importance of discussing their feelings, because I feel like we only get um, mental health suggestions or mental health help when we are older. So I feel like it should be implemented in the education system to have a session with each children or with each class to say it is okay, this is mental health, this is how you feel, and if you feel sad, they should be able to reach out for the teachers. And obviously it is very important that maybe for parents to kind of have that mental kind of have courses for parents so that they are able to kind of educate their children about mental health, so they are able to kind of seek for help if they do need it. And also we are living in such a generation of rich social media. So obviously I feel the best way to reach a lot of people and to reach a lot of bodies is through social media, which is something I think Sister Novi has already done. So that is very useful. So just increasing social media presence is also very useful. And for someone who does not live in the city but have access to, let's say, the internet, maybe not everyone does, but for those who have access to the internet, it could be a starting point and it could be a platform to reach out for others. I think your second question was how do you break the barriers, right? Um, I think uh, it is sad for me to say, but you cannot change unless you want to change yourself. And obviously, for people who are suffering in silence, it is very it is very hard for them to reach out first. So if you see someone you know like a friend or a colleague that seems to be struggling. You can look through their behaviors. If they are struggling, perhaps their hygiene has not been good recently, or there's some changes in behavior. Perhaps you used to kind of hang out with them, but they are not able to meet you as often or something. It's more like you have to reach out and show them that there is a hand to hold. And because I am not qualified to suggest further details, I I think you should perhaps ask someone who is more knowledgeable, because I could only say so much. um, as I do not want to stick my foot to the um, somewhere I don't really know. But thank you for your questions.
Thank you very much. Maybe Sister Taiba could answer the question if you'd like to.
So even though she claims that she's not a professional, I think she's put it really well. Um, when it comes to breaking the barriers, of course, one of the first and foremost things we have to do is target the problem at its root level. And like I've been stressing, I think that this needs to start from a very young age. And I think one very important thing she brought up is that we're so focused on what can we do for the children, what can we do for the youths. We forget all about what should we do for the parents, because I think one of the biggest problems is we're dealing with the children, we're dealing with the youths, we're forgetting that the parents have no idea how to deal with troubled children or troubled youth. So I think that information has to reach parents as well. But one other thing that I'd like to suggest is that sometimes it's the teachers as well. They're not really well informed on how to handle disturbed children, be it in the school level or the university level. So, with because of their own frustrations, they keep saying things like, you're just being annoying or you're being a troubled child, right? But maybe changing that dialogue, maybe understanding that if this child is giving me trouble in the class, there is something going on, let's address that. So I think other than focusing on the victims themselves, who are the children, the youths, it's also important to see who else is there in their surrounding who is getting affected, or maybe is the reason towards them struggling with their mental health. So I think seeing it from a more systemic perspective is also another solution.
Thank you, Sister Taiba. I'd like to ask Sister Asma from Egypt. Um, your suggestions or ideas of solutions, of course, and also we heard from the previous panelists about the importance of educating parents and teachers. So, in other words, educators, be it in the home setting or the school setting. So, what do you think could be the steps to further enhance their skill or in reacting to how children or students emotional emotional vomit, not necessarily that, but when they speak, how do you respond? Yeah. You're muted. All right.
Sorry. Firstly, I would just stress on something, like physical symptoms. Physical symptoms, like in any physical disease, like it is really appear to the body, the doctors see in it. So if someone like have like in a pain in his like right iliac fossa, like we will see that he's like had acute appendicitis, or maybe if she's a female, have gynecological symptoms or have urinary symptoms. But like otherwise, like mental disease, that it's really hard to reach the diagnosis, because it is something like spiritual. So that's why we don't have this awareness about that. To help this problem, we should identify first what kind of the disease. We have a variety, it's just not mental health, like it's like a big thing. We have like ADH disorders, dissociative disorders, feeding disorders like anorexia nervosa. We have diseases like sexual disorders, gender disorders also, cognitive disorders. We have bipolar disorders. It's like there's many and many, so we have just to identify which one. Like for most of the like medical students, like the students in university, they have like, because of the contents what they had, or this, so maybe they go like depressive disorders and the stress and this way. But firstly, the most important thing just to identify which disorder that he got affected with. So we just have the problems, we have know the disease, the diagnosis, so we will start the treatment. So the treatment would be like in a group, or like a group or family, or like a health administrative, like a psychiatrist. So he will describe him like a medications, but I don't like that the medications will work with it, because we know that medication have side effects for that. So psychotherapy would be better in a group or a family. This one of the solutions. But I would say, like in my opinion, if someone had some kind, because we, even us, any person, any normal person in this world would have like a mental health, but we have like differences in which mental health. So we should have like the awareness how he could overcome this, but the way that he will choose inside how to overcome the problem. Like, I think we all have been with mental health diseases like stress and depressive and this and this. So how could we overcome this? Like, for example, for me, I could just go to do some sport, or just to try to engage more with reading, just go to speak with my family, my friends that I love, just to try to change the way. Don't think about the stress, but just to change the direction to another like perspective. So this is like the only treatment come from the person, like you got me from inside, from inside him. That's like what I think to develop like psychotherapy, or just from the person inside. Like family members, you said that family members should be educated well for causing their children. Maybe most of the family members would not accept that, because even people would not in rural areas, for physical diseases like liver hepatitis, or any other physical diseases, they don't take care about it. So how can they would take care about the mental illness? So this is an issue also, how to change their mind perspective or mindset about the mental illness. So it will just come by awareness about the issue, and the degree of the dangerous that their children would go through these phases. uh, that's like what I think about it.
All right, thank you. Okay, let's go to next sister from Indonesia. I like to ask Sister May. What just now she mentioned that instead of thinking so much about the stress or whatever is causing you, that's triggering you right now, you divert that into somewhere else. So I think that that is somehow like some type of coping method where we distract ourselves from whatever that is causing us distress, and that coping method can help us be more resilient. If we find the one that is effective to us, it can help us be more resilient, as what Sister Claria said just now. It gives us the ability to bounce back. If we encounter any problem, we can be from sad, and then we can be more to neutral state where we can be happy again. So uh, first, what are your general ideas or solutions? And I would like to add on that question: how do we improve this resiliency, or how do we let youth of today know more about coping methods, and especially encourage them to explore more, because not all methods are suitable for all people. Sometimes you have to explore so that you know which is suitable for you. Yeah, please.
Okay, thank you so much for the question. So I'm going to talk about it based on university level, because actually in my university, they actually put a lot of effort and they did a very good job on taking care of every student mental health. Like every semester there is like consultation session or counseling, because sometimes we just want to talk, we don't need any advice, so they also offered us that. And the lectures, I'm talking about the lectures, they are very helpful. They actually, I think they are well trained on how to treat each student, not only academically but also like mentally, physically, and like emotionally. So they actually encourage us to like do better rather than pressuring us too much. And also in our university, we also have a mentoring program. It means that the senior or the one that uh, did better in their academic study help the one who like struggling with their academic study. So the mentee, when they are having their own mentor who is out there, also a student, they feel like they are not alone during the journey. So I think it's actually a very good solution, and it should start from school first, because I don't think that talking to families is that effective, because our parents somehow they are like in older generation, they don't really have social media, so they don't really understand how those like body shaming or like cyberbullying, toxic positivity affect us through all of those platforms. But for us, we are in the industrial revolution, so we face a lot of problems. I mean, like even though you're staying at home, you still get bullied from uh, those social media platforms. So it's actually like two different generation. I think it should start first with the university. And sorry for the second question.
For the second question is, how do you think that the youth can improve their resiliency by letting them explore various coping methods?
Mm, so from my perspective as a youth, I think we as a youth can play important role by promoting this mental awareness, maybe like creating videos, or like we should have more of like mental health related competition and those kind of stuff, so youth, they have an opportunity and they have the courage to uh, speak up for those who don't really have a voice to say what they are struggling. Yeah, I think it's like the encouragement and promotion of mental awareness through youth. Yeah.
All right, thank you. Thank
Thank
you.
you.
I'd like to ask Sister Aisha from Singapore. I'd like to ask, what are the options or ideas you can do, especially from Islamic perspective?
I actually would like to acknowledge the Sufyan point, because many elderly wouldn't admit that mental illness exists to an Islamic perspective. For example, Ibn Taymi al-Balaghi also touched on the solution of striving for a cure, because in Islam, as determined by God, every disease has its own cure. So, as a believer too, we are acknowledged to ask the expert. وَفَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ, meaning that we should ask the expert who are um, in this field. So, acknowledging that this sickness is affect, affected by many, we could also say that according to our preference, maybe starting from approach our loved ones, our close ones, from maybe family members, mothers, and then if it's severe in a level, considering the state of the illness, we could then seek professional help. Like for example, it is fair enough to promote the CCSA um, service that our university provides, as psychological concern, career related concern, and the clinical concern, others studies related. related, such as the workload that we might can consume in a brief. So additionally, as said, the generalizing it's easier, but in every method, every sickness, it depends on the severity of the person. Um, if it's unmanageable, um, as Islam pushes us to also approach, uh, it is mentally improvised by our deen. So yes, I think to acknowledge also our proposal, one proposal in Singapore is the grace days, which allows students to delay their assignment deadline. So it gives them sort of flexibility to manage their workload that has been used in multiple universities, included Oxford. So this approach could be applied in maybe in our university. Looking forward to any solution towards an advancement job.
All right, thank you. Thank you very much. And lastly, Sister Maddie from Indonesia. Yeah, someone would like to add anything?
Sorry, I just want to add one aspect from the Islamic perspective.
Please
And
do so.
yeah, personally, me, whatever I have some kind of any depressed or have any mental health problem, beside exercises, I always look back to the stories of the prophets or to from the Quran. And I will look back to the difficulties and challenges that Prophet Yusuf, Prophet Yunus, Prophet Ayub, Prophet this, all these challenges. What was the solution that they was able to overcome these problems? And always whenever I have this kind of a problem, mental health issue problems or something, I will look back to the stories of Quran, stories of prophets from Quran or any Quranic stories, and to see what was the problem here. And for example, the story of the father of Ayub, Yaqub alayhi salam. He was at this at one time he was very unhappy. He was in Arabic he was hazin. He was very unhappy about the problem of Yusuf, and what was the solution? He overcome these challenges or problems, and I think these also the stories of the Quran also play a very important role in order to overcome mental health issues. Thank you.
I'd like to ask you, Brother Sufiana, in the community at your country, do you use that method, the using the stories within the Quran, or any other religious context? It may be the Hadith or whatnot. Is it what is commonly used or only used by you? And what do you think of adapting this into a formal, systematic education system?
In school, yes, sure. In school, we learn all these stories, but it's not something related to or specific to mental health issue. We just talk about difficulties or challenges. Any difficulties you have or challenges, just be patient and it will pass. But it's not like something. Very specific to mental health issue or something like this. Yeah.
All right, thank you. Thank you. Now, let's go back to Sister Mehdi just now. Yeah, your solutions and also a question of we've been asking the perspective the solution for maybe to approach the government and whatnot. Let us look at the individual or regular citizen. So what do you think an individual or regular citizen can do to make an impact, and how much of an impact can it make?
Okay, thank you for the question. Maybe as an individual, maybe we can, because I'm not really from Muslim, I will just use a general perspective where in my culture, we use meditation as if we have a trouble having a trouble day or having a bad day. It can be seen as a spiritual perspective or productivity perspective. So that's one of the things as an individual. But for a government, I'm not really quite sure, but and for the citizen itself, maybe because from my understanding and from my perspective is that social media is very a powerful media right now in this era. Maybe we can like invite like mental health community can engage with celebrity or influencer and around the world that say to so that the influencer and celebrity could engage to their followers and that the followers know that how bad and how the situation of our um, each of our countries is having right now. Maybe from another solution from my own perspective, because I am from business information system, which related with technology, maybe is that right now there is so many company that is making like a startup company or technology. Maybe we can implement that like health and technology into a combination where because not counselor or psychologist is handle so many patients, maybe with the help of application, it will know it can like read like a machine learning to read the user, or we can say it as the customer of it, like knowing the like analyzing the mood of each of the customers or the user of it, and then they can make a journal because I have this course called entrepreneurship. I implement mental health and technology into one. So my output is that we have an application where we can consult consult having a chat or call with the professional counselor or psychologist, and which the user can choose, which depending on their situation, or if they don't want to, they are still like uncomfortable with the to talk with the counselor or with the psychologist, they can write it in the application like a diary of a digital diary like that.
Actually, I'm so amazed by what you said just now. Maybe I don't read enough, but this is so new to me. Like, this is so breathtaking. So I wonder, does this use something like artificial intelligence?
It's more like machine learning. So every time like there is one feature like Instagram feed like something like Instagram, but this one is more like a community that is more like private because we can't show the name of the user. It's like anonymous user because we want to prevent like bullying or self-harm, or like sometimes word can hurt other people, so we prevent that kind of stuff. That's why we don't want to use a user's name. We just call a user or our customer as anonymous.
So this has been tested before.
No, actually it's just an idea, but
Oh, it's idea.
there is some application in Indonesia called Relief. I think it's similar to that, but it's more, they are more like um, scheduling with the psychologists and also meditation. They are more like focused on that, I think.
All right, thank you. Thank you very much. I like it so much. Okay, we have heard from all the panelists, I believe. No one has been left out, right? Okay, so I will try to briefly go through what we have learned from Sister Aiman. Sorry, from Sister Aiman. We have eh, sorry, there was a suggestion that we should treat or give them education since early age, especially by providing class and acknowledging their feelings. So, especially in that, the parents need to play their role, and in social media, as said by all, that they can be used so that it is easy to reach people, it is accessible, and it can increase social media presence. We have a lot of similar ideas actually. That's all right. It just proves that the method works. So we have mm, from Hassan from Bangladesh, which is to bring the government to take initiatives to provide more rules and enforcement bodies with experts in mental health issues. I think that's a very bright plan, but it needs more planning so that it reaches there. Because for now, I do not see the possibilities of it easily happening. And make medications more accessible. This is almost similar to what Sister Asma from Egypt said. So there's been a lot really, but we will time. We are having some time constraints, so we will move to the Q&A session. We will now entertain the questions from the audience. One one question have been received to Sister Natida from Thailand. Just now you mentioned that the question is just now sorry, the question by Sister Aina Afifa. Just now you mentioned that students from school suffering mental health issues. Is it because of the education system or school surrounding, which is the people in it, like teachers, students, friends? So what are your thoughts? Uh, it seems that her connection went offline. Would anyone else like to answer the question? Maybe Sister Ayman from Brunei?
Sorry, so the question was either it is a result of the way the education system works, or if it's because of the teachers that are involved within the education. Is that what?
Teachers or students, the people. Is it the people or the education system?
Okay. So I think that is a very interesting question, first of all. So thank you for asking. But it's always a combination of factors. In terms of education, I understand that obviously somewhere like Singapore is very driven and is very successful in that matter. So success is perhaps one of the driving forces for them to provide such high levels of work. And also teachers are probably in the same mindset where working hard equals success. But I think as we have recently discovered, there is such thing as toxic positivity, where you are putting yourself in a position where positivity is not helpful, if from what I understand, and it's the way where you're overreaching and you're not being smart. So you're not, in terms of, you're not thinking about the does anyone know what the smart goals are? um it's basically a thing where you set up something. You have a goal, but you also have a timeline, and you have like a deadline, and you are realistic about it. And I think a lot of the times, perhaps this is overreaching to most of Asia. We are very driven by success individuals, if that makes sense. And for us, sometimes we value working hard more than ourselves. I'm not sure if that is true for everyone, but I think it's a bit of both, where you have to understand that work balance is very important. And when both the education system and people involved within the education system are stuck in a mindset where working hard equals success equals happiness, we need to change that equation, where we go, working efficiently equals time for relaxation equals happiness equals success, if that makes sense. Yeah, thank you.
Thank you. It makes total sense. Yeah. And a question to Brother Hassan. Um, betul lah, Brother Hassan. We heard just now that she mentioned that the education. So the education, especially in university level, where we see that most courses are compartmentalized. We see that when we compartmentalize them, it is hard for students to put them all together. So it does not only apply to academic subjects. For example, first you learn math, and then you learn algebra, and then you have to combine things together for trigonometry, for example. So it also applies to things in real life, where if you take apart academics and mental health, if you take them apart, so people will have a hard time to think that they are both important, and to think that it needs both to make a successful human. So instead of focusing on human capitalism, we want to move forward to humanism, or to instill that humanism in our education system, right? So what do you think? What do you think should be the steps uh, on any level, be it in individual level or university level or government level, so that people will start looking at the capitalism side, and will start look more at the humanity, humanism side, yeah, and to merge that together, yeah.
Thank you, Sister Iman, for an excellent question. I think we should, yeah, as you are mentioning about compartmentalize, like we divide all the studies in section by section, but we are not integrating. I think we should integrate the all the aspects in our education, uh, and also as you're asking, like what could be the initiative. I think the initiative should be from individual level, society level, and from the university level as well, and the state level. From the individual levels, like each one of us have a different profession. Some of us students, some of us are working. So first of all, we have to know ourselves, and we have to practice to take care of ourselves, and we have to believe that we are living a life that has some purposes. And also in our personal initiative, we have to add specific activities for our daily routine, which will give us good well-being, like games, different hobbies, volunteering, listening to podcast, being grateful, helping others, or learning something new. I think that could be our personal initiative to solving this issue. And from the family, community, and university level, I think it's necessary to work in a partnership with the university, with the organization, club, and society. Like in UIA, we have CSC, the Peers Gumba, and under the psychology department, they have a society, I think, and other society as well, like IMSU, the Students Club. I think for university level, university students should work like as a group, like all the society. It doesn't matter if it's specific for mental health. Every society can aware about it, can spread the awareness of the mental issue, and also they can organize the workshop campaign in every few months. And also the another thing is the contribution from our elders or religious leaders, and also from the lecturers. So every day we are having classes, we go to mosque to the pray, we go to the different religious places to pray and do our activities. I think they should aware among the people, and they should give the support whenever it is necessary. And also that we have to have a crisis management team and some volunteers in the school and also the university level who can help the students. Like doesn't necessarily to be a psychologist or psychiatrist, but it can be someone who can at least listen to the people who are having issues. I think sometimes when we talk to others, I think many issues being solved automatically. And also there can be forum, like as UIA is right now is organizing Grand Mental Health. I think there could be forums and activities uh, in all the universities and also that in the school level. And also the community and the people needs to understand and decide how the knowledge should be obtained from the relevant workshop. And also they have to enable those learning to address and prevent mental health issue. And the point, like apart from the personal initiative and the family, community, and university initiative, as I mentioned earlier, the state initiative, state initiatives. I think state initiatives is one of the important because I think the state can make it compulsory to provide mental health educations to everyone. It can be starting from the school, and also they can, like in each in every year there is a mental health day. I think they can announce a month as a mental health month, the state level as well, to help create awareness. And also state can take university students as a volunteers, and they can give them training and supervise to spread awareness. And also not only students, even they can encourage the government employee, and also they can learn with initiatives to different offices from different parts of the government, so that people are aware of it, and people doesn't feel that it's a taboo or it's something that we cannot do. I think consciousness and awareness is the most important. And the last, I think we have to be more positive, and also we have to spread positivity. It can be through our daily lives, or it can be through social media, and also the regular virtual and live activities can be more helpful, and it can build a better future for ensuring mental health protection for everyone, for all. Thank you.
Thank you. That was a lot. Thank you very much. And a question to Sister May. Sister May, it's a classic question. There's been a lot of stigma on mental health, right? So, what do you think we could do on any levels to overcome that stigma?
I believe that to overcome the stigma, we have to create more like something that will raise more awareness on mental health issue, like webinars or education for youth, and also maybe for parents, because sometimes parents always see that as a weakness when a child trying to express their feeling, what are their struggles. So I think it's also important to uh, acknowledge them about this. So like rather than webinars, we can also encourage youth to express their feeling freely and publicly through videos or photos, campaigns, or maybe social media posts, something like that.
Okay, thank you very much. That comes the end of the problem. So, if anyone would like to do any closing remark or final hope for the future of mental health, and I open the floor to anyone. If anyone would want, if anyone would want, yes. On the count of 1, 2, 3. All right. So, honorable guests, brothers and sisters, we have now reached the end of this event. Special thanks to our panelists, Sister Aisha, Sister May, Sister Ayman, Sister Taiba, Brother Hassan, Sister Novi, Sister Madeline, Sister Asma, and Brother Sufiana. Yes, for actively sharing their ideas and thoughts with us today, for us to enjoy such insightful discussion from the viewpoints of youth from various countries. And of course, thank you all the audiences at YouTube with us tonight. I, on behalf of the organizing committee, would like to apologize for any shortcomings caused by us during this event. Let us end our program today with the recitation of Tasbih Kafara in Surah Al-As. وبالله التوفيق والهداية والسلام عليكم ورحمة الله وبركاته. Inshallah till we meet again. Good night.
Waalaikumsalam. To everyone, you are required to stay for photography session. Thank you.